Welcome to the podcast. The Aging Queen. Welcome to the podcast. Welcome to the podcast. And welcome back to another episode of the Aging Queen podcast. My name is Louis Canetti, and we have our Sanjay Gupta, which is our Dr. Kristen.
Hi, that's so funny. I like it.
I think you have to be our Sanjay Gupta now.
Yeah, I'm a white female version of Sanjay Gupta. I'll take it.
Hey, you're a friend, and I don't have to pay. So this is
That's
this is
perfect.
this is the option we have, and you're
Uh,
fantastic. Um, yeah, I wanted to bring you on the show today to talk about another medical topic: cosmetic surgeries. Are they necessary? Are they vital? Are they risky? We're going to discuss all that in this episode. So, Kristen, why don't you start us off by mentioning some of the procedures that gay men or just men in general are starting to get? I looked up a statistic, and in the last 20 years, 29% increase in men, not just gay men, getting medical procedures for cosmetic purposes. So,
yeah, I actually saw that same statistic. There was a journal article published in a medical journal called Plastic and Reconstructive Surgery Journal. And they also reported that there's a 29% increase in plastic surgery among men.
mhm.
Gay men are thought to be one of the fastest growing client bases in the cosmetic surgery industry.
Wow,
However, precise data are difficult to obtain because surgeons rarely ask patients about their sexual orientation.
right.
And I'm just reading from the article itself. It
Mhm.
says LGBTQ and friendly plastic surgeons report that the most common procedures they perform are liposuction, laser hair removal, pectoralis or calf muscle implants, or Botox injections.
Yeah, Botox
However, yeah,
is
and it's Botox, but it's Botox maybe in a place you didn't expect.
what? Where are
um,
they putting the Botox?
and well, the article continues and says in the past few years, the field of anal rejuvenation has
Lord.
emerged in larger cities such as LA, New York, and Chicago. These non invasive procedures consist of injections of Botox, lasers, bleaching, tightening, or loosening of the anus.
Oh my gosh.
Aside from plastic surgeons, some colorectal surgeons report that their practice now consists of 20% anal rejuvenation services from the gay community. So,
Okay,
yeah,
so
anal
why would
rejuvenation is
people
the new thing.
yeah, why would they, I mean, other than the obvious reason of why why I mean, okay, this is a
Yeah,
lot to
take
unpack.
a minute. It's a lot
I
to
gotta take a
unpack.
I gotta take I gotta take a breath. Um, very few times you actually see the thing is what I'm saying is why does it, unless you're a porn star, I don't see the need for this, maybe? I don't know. I mean, hey, I don't judge. I just give my opinion. And I think it's good that we're having this conversation because some people really go out of their way to feel better, and this is one of the procedures that makes them feel better. Why do you think people get this though?
well,
Is it just superficial? Is it a fad?
so it depends on which one we're talking about. If we're talking about the Botox injections,
Yeah, the
um,
anal Botox. Yeah,
yeah,
that's
and those are inside your
oh my
rectum.
god.
It's not around the anus, like superficially, like where you would bleach. That's not the same area that you would put the Botox. You put the Botox like all the way inside the rectum, so you have to actually expand the rectum, like hold it open with
This is a
something, and
bigger
then this is a
procedure
bigger.
than
It's a bigger
yeah.
procedure.
Wow.
The reason that it's done, according to some medical articles that I was reading, is that it allows men who have anal sex to have more pleasurable anal sex if they want to take larger penises or larger toys. So it allows for deeper penetration
I see.
and for people who want that, and so without the
But
pain.
wouldn't you lose feeling if you're actually putting Botox in that region?
No, that's a great question. Botox does nothing to the sensation. It
Oh.
is it's actually a toxin. It's called botulism toxin that
Mhm.
temporarily freezes muscles. It just freezes them. It prevents them from contracting. So like by freezing them.
Mhm.
So it doesn't affect the sensation, it just doesn't allow contraction of your muscles. So basically it loosens your muscles.
Oh, I see. So that's why they can it'll expand during sex,
Yeah.
basically.
Yeah,
A
exactly.
and does this last I mean, from my knowledge of Botox, and I've never gotten it, I don't plan on getting it. Not yet. Um, do you and I'm talking about face Botox here. Um, do you it doesn't last forever, right? Just
No,
like the
about 3
facial
months.
Botox?
You
Okay.
have to re-inject about every 3 months.
It's painful? Is it lengthy? How many people are getting this?
It is so I have had Botox, like, injected into my forehead, so I'm speaking from a personal perspective, not a
Yes.
doctor perspective, but it
Mhm.
doesn't really hurt. It's like a mild it's like a very mild
Pinch?
sting for a
Okay.
second, and then it goes away. But the rectum is more sensitive than the face, so it probably does hurt. I'm just gonna guess that it hurts in the rectum more than it would hurt in the face, because of how many nerve endings there are there.
D Are older people getting this or younger people? Who's getting this? Does
Well,
it say
it
or
doesn't say. There were no statistics on that I found.
Mhm.
Uh, the I would imagine it's I would imagine it's younger people who because older people who have been having a lifetime of anal sex already probably have a looser rectum.
Mhm.
They probably don't
Yeah.
need it. It's probably younger people who haven't had the years of expansion, basically, of the rectum and want to take something that's larger in their rectum without the discomfort. So that's just my guess, but I didn't see any data on that.
Wow. Yeah. I mean, it's something to look into, I guess. And the anal bleaching, is this like an added value one that you well, hey, we're down there. Let's bleach
Yeah,
people.
it is. It's like an added so the anal I know it's
It's
the
a
anal
bonus
bleaching
pack?
is a bonus pack, exactly. It's completely separate from the anal Botox or the rectal Botox. They serve completely separate purposes. The rectal Botox, like we just talked about, is to loosen the rectum. And those are injected like inside, like we talked about, inside the rectum. Um, the anal bleaching is much more superficial. It's just that dark sort of ring around the anus. So
Mhm.
that's pain free. There's no pain with the anal bleaching. Um,
Why
you
would people
there's
get their anus bleached?
you tell me, Lewis.
I have
I don't
no
know.
idea.
I don't
Hey,
know. I
I'm
mean,
just as lost as any other non-anal bleacher. I don't know. I mean, I like I said, you barely look at the thing. There's an article. Anal Botox patients explain how the procedure improved their sex lives. This is an article in the Business Insider written by Julia Noftalene on May 6, 2023. States that some doctors are injecting Botox into their patients' rectums for more pleasurable anal sex. Insider spoke with rectal surgeon Dr. Goldstein and two of his patients. They said the painful sex led them to try this procedure, which involves spreading your butt cheeks for 5 injections. So some people are getting it for actual medical reasons, not just superficial reasons. Like
yeah.
it's painful for sex is painful for them.
Yeah, if they have a very tight anal sphincter or if they have very tight rectal muscles or if they're having spasming of the rectal
Hmm.
muscles, and anal penetration is uncomfortable for them, then
Hmm.
this would be like that would be a medical procedure and their health and their medical insurance would cover the cost of that.
Okay. Yeah, and it states here, I tried butt plugs, dildos, having anal sex with boyfriends, and it just wouldn't work. It was excruciatingly painful to the point that I almost passed out a bunch of times, said the man who requested to remain anonymous to protect his identity at work. Goldstein, the man's doctor, told Insider that the procedure can be a game changer for anyone who wants to have more pleasurable anal sex. It's also useful for those who want to go further with anal play. patients recovering from anal surgery injuries due to tears, hemorrhoids, or fissures, he says. So there's a variety of uses, but there is an actual medical, need for it. If
Yeah. Yeah. I think
there
like most cosmetic surgeries, like you just think about breast implants, for example, in women, most
Mhm.
have a dual purpose. They have a medical purpose for women who had breast cancer and had their, breasts cut off. And so they
Yeah.
use reconstructive surgery for like a legitimate medical reason. And then there's also the women who just want implants for larger breasts. So I think the anal Botox is similar. There are some legitimate medical reasons, and then sometimes it's just used for cosmetics.
Benefits of plastic surgery. Several studies have demonstrated how plastic surgery can be extremely beneficial for patients' mental well being. According to an academic paper written by Timothy P. Moss and David L. Harris, patients who underwent cosmetic surgery reported lower levels of depression and anxiety. Another study involved 228 participants found that 94% of people who made use of these practices further recommended their operation, and that 84% of the total participants reported being satisfied or very satisfied with their final results. So
Good. I mean,
it
that's
could
good.
make you feel better about yourself, too. What's basically saying.
Yeah. I mean, like the dark hole that some people get trapped in is this like body dysmorphia
Yeah.
where they don't like how they look, they try and fix it, and they go to the gym or they get cosmetic surgery and they spend lots of money and then they still don't think they look good enough. And then they need additional surgeries and then you go down you sort of start spiraling the drain. So, I mean, I'm glad that the majority of men and who get these cosmetic surgeries are pleased with the results because then, at least they don't go back for more and go back for more and go back for more.
There's an article in the BBC, published January 28th, 2020 by Ben Hunt. He's an LGBT correspondent, states the gay men risking their health for the perfect body. You're too ugly to be gay, a man in Huddersfield gay bar told Jacob. It was the latest in a series of comments from men that Jacob said made him feel worthless. Last summer, the following comments, he tried to kill himself. So men are also. There's another episode that we recorded actually yesterday, where we were talking about labels, twinks, hunks, bears, and is it healthy? With the other guest speakers, is it a healthy thing to label each other these things? Um, I think we ended up with a resolution that, well, you got to listen to the episode, but it's a mixed bag. It's 50-50. But what we did all agree on is that we in the gay community are actually our own worst enemies. I have been, for instance, I know that from my experiences, the nastiest I've ever been treated have always been by people of the community, ourselves. So this article does not surprise me. You're too ugly to be gay. Another gay man said that to this gay man. It's horrendous, but it leads to people want to change their looks, want to change their bodies, not to make themselves feel better about themselves, but to fit into society. Why do we do this to ourselves?
Well, I think that, um, like studies have shown that men, as compared to women, value physical beauty more, and that's
Mm,
why women who want to attract a heterosexual male, that's why women get so much cosmetic surgery,
right.
um, and so gay men are in the same unfortunate boat. They also want to attract a man who very much values physical beauty more so than women do.
They're
So,
just trying to compete. Is that what it
yeah,
is?
yeah. So, straight women and gay men are in the same boat trying to get the attention of someone who really values physical beauty. And so,
But do you
I
wanna
mean,
be
I
with
understand it.
someone that's superficial, or are we all just superficial and it's all about, whose feathers like peacocks, whose feathers are brighter? And
I mean,
does it
I think we're all
come down to that?
superficial to some degree. I think that, like, I think most people would never be with someone only for looks, like
Right.
that was the only thing, but I think it factors into a lot of people's decisions on who they choose for a partner, to some degree. And so it does, I mean, I hate to say it, but I think it does matter.
There is some, I mean, attraction is attraction, right? Um, y Gay men in New York City have developed a desire and need to look younger and refreshed. In the competitive NYC marketplace, where looking fit and more masculine is imperative to your chances of ascending the corporate ladder. This was taken from a website of a prominent plastic surgery a surgeon in New York. What are some popular procedures for gay men or men in general, Kristen, that people are getting?
I think that this article that I had read, that I had quoted before, highlights liposuction, laser hair removal, pectoralis or calf muscle implants, or Botox injections and anal rejuvenation.
What
So,
are what about butt implants? Why would people
that's
get?
not the top of the list. It says pectoralis or calf muscle, so chest or calf muscle implants. But I definitely saw something online about butt implants.
Mm.
But I don't think it's, according to this article, it's not the most common.
And some people have also been getting chin implants.
Yeah, yeah, for sure. Chin implants to have a stronger jawline.
Hmm.
You can get liposuction if you have a double chin. Like you can get liposuction to get rid of that kind of waddle under your chin.
What if you have
Um,
triple chins?
then you need to get extra
You get a two for
liposuction.
one. Yeah.
Yeah, yeah. But if you do get liposuction under to remove the fat under your chin, if your skin is saggy, it will continue to hang,
Hmm.
because it's already been stretched out from the fat. So then you would need to have a chin tuck, which is like you have to pull the skin taut. So there's like, fixing the chin, and then there's also the chin implant. So fixing the chin is, there's like several different avenues that you can take. But it's a complicated situation, the chin.
And there's a lot of recovery time.
Most surgeries, that would be an invasive considered an invasive surgery if they're
Hmm.
putting in a chin implant. So I would say probably 6 weeks, 4 to 6
Oh
weeks
wow.
recovery at least. But liposuction is minimally invasive. That there really is not much recovery, maybe a day or 2.
They just suck things out, right?
Yeah, they just suck things out. There's nothing, so really it's just the little holes that they make in your skin to put the vacuum tube in
Hmm.
that need to heal, and those holes are, an inch or
Now
less.
they're sucking out fat, or do they suck out other stuff too?
In liposuction, it's just fat. It's supposed to be just fat. Um, yeah, the rest of the cells, and it's like they will, like, take the liposuction tube and they will scrape it under your skin to dislodge the fat, and then
Oh
they
my
suck it out.
goodness.
I'm sure they get some cells that are not just fat. Um, uh, like, I'm sure it gets, um, other cells, but the majority of what it sucks out is fat.
I take it liposuction and any of these procedures that end up being life changing for the positive are empowering to people. But are there also some negative side effects or dangers?
So there's always risk inherent in surgeries. Um,
Hmm.
but these surgeries they do a lot of these surgeries every year, and the vast majority are fine.
What are dermal fillers?
Um, those typically are injections under the dermis, under the skin, to
Hmm.
either um, sort of magnify your cheekbones,
Hmm.
or like to make your lips more full, like injections into your lips to make they're more full. Those things the body will break down, and
Okay.
so you would have to get those injections like every 6 months, or every year, to
Hmm.
replenish that. You also can get like permanent cheekbone implants put in, if you or permanent lip implants put in, but those tend to look more fake.
Right. You got to figure out, ask yourself, why are you really doing this? Is this for yourself or is this for others? Because from all the statistics and everything that we read, it's basically saying it's kind of like a 50-50 thing in the sense of yes, there are positive uh, outcomes is on your mental health and your happiness, overall happiness. What about as we age, a lot of men are attached to their image and their self-esteem is attached to their hair. And as we
Mhm.
age, men bald naturally, some faster than others. There's a big trend of going to Turkey, for instance, to get hair transplants. Do you
Mhm.
know anything about this or hair transplants in general? How long it takes, the recovery? Is this a miracle procedure? Is it permanent?
That is so funny that you mentioned that because I literally was just talking to another doctor maybe 2 days ago, and he told me that one of his patients just got back from Turkey for
Really?
to have hair implants. He said they look good.
Really? Yeah,
Yeah, it's such
there's
a weird
a
coincidence. I had never heard of that before.
there's a lot
Um,
on social media where they'll show, on Instagram, like, 6 dudes with, covers over their head, um, coming back from Turkey, getting hair transplants, so, but why has Turkey or, why has Turkey become kind of the hub for this? I think you've given us a lot of insight to these, procedures and what my takeaway from this is, if you're gonna get anything done, do it for the right reasons.
mhm.
Because at the end of the day, even if some of these are not permanent, they will leave a mark somehow, and it's never gonna be like it used to be before. So make sure you know what you're doing before you get any of these procedures, and consult your doctor and make sure that you're healthy and it's going to be a positive thing for you. Um, well, thank you so much, Kristen, for helping us yet again with another episode and for giving us this great insight personally and as a professional.
Yeah,
Um,
thank you for having me again on the show. I appreciate it.
oh, you're going to be a regular. You're
Well,
like
we
I
have to
said.
talk hair
Uh,
transplants next,
We have
so
to talk about that. That's right. We haven't covered that. We have so many more things to talk about. Okay, so thank you again for being a part of this episode, and we'll talk again soon.
Okay.
Thank you.
Bye, my friend.
If you are in crisis and need to speak to someone, please dial from your cell phone 988. When dialing or texting 988, you will reach out to a National Institute of Health professional that can help you during your crisis. You can reach a specialized LGBTQI plus affirming counselor by texting Q to 988 or by calling 988 and pressing 3. The information provided on this podcast are opinions and are for educational and entertainment purposes only, and does not substitute professional medical advice. Consult a medical professional or healthcare provider to seek medical advice, diagnoses, or treatment.